Drug Education. Republic Act Number 9165, an act instituting the Comprehensive Dangerous Drugs Act of 2022. So, what are drugs? Drugs are chemical substances that change the ways our body works. So, drug is a chemical substance that brings about the physical, emotional, or behavioral change in persons taking it. So if you're wondering if drugs are harmful, yes it is if you combine it or if you are taking too much from it. So there are three types of how you take the drugs. It is by swallowing, inhaling, and injecting. Drug is usually made for medical reasons na ay drugs na dili harmful which is ginagamit for medications. So, we have four types of drugs. These are stimulants, hallucinogens, sedatives, and narcotics. Wanna know about stimulants? These are the drugs which increase alertness and physical disposition. So, these drugs can cause you to lose your appetite, increase your heart rate, cause you to panic, hallucinations, and make you feel irritable. The examples are cocaine, amphetamine, and nicotine. Next is hallucinogens. These are the drugs which affect sensation, thinking, self-awareness, and emotion. It can also affect your senses, change the way you see, you hear, taste, smell, or feel things because it speed up the function of the nervous system. The examples of these drugs are LSD, mescaline, and marijuana. Next is sedatives. These are the drugs which may reduce anxiety and excitement. It can slow how your brain activate and it has calming effect that can induce pain. The examples are barbiturates, tranquilizers, and alcohols. Last one is narcotics, drugs that can relieve pain and often induce sleep. The examples are morphine, heroin, and codeine. It is a pain reliever lang ni siya, only used for pain that is severe. Mao ni siya nga drugs ang effective for reducing pain. That's it.
How can we tell when one is using drugs? We can easily detect that a person is using illegal drugs through their eyes. It is very common that the eyes are red and pupils are larger than usual, but some pupils are smaller than usual. The majority of sudden weight loss is caused by irregular sleeping patterns and not eating too much because they have become addicted. But this really depends on a person's changes in appearance when using drugs, but these are very common. Next slide please. Constricted pupils may be a sign of a larger issue with your health. Morphine, codeine, and heroin are examples of narcotic drugs that relieve pain and often induce sleep. Oxycodone, hydrocodone, and methadone are opioids that are a class of drugs used to reduce pain. These can be prescribed by doctors to treat moderate to severe pain but can also have side effects. Fentanyl is a synthetic or we say a man-made opioid pain reliever. Red eyes. Cocaine is a drug which increase alertness and physical disposition. Marijuana, a hallucinogen, drugs which affect sensation, thinking, self-awareness, and emotion. Benzodiazepines, example for that is a Xanax. Depressants can be swallowed, drunk, and injected. For instance, the alcohol is drunk that can affect concentration, coordination, and also down to respond to unexpected situations. Methamphetamines like amphetamine causes increased activity and talkativeness, cocaine or crack. Next one is the hallucinogens. Are illegal drugs affect your mind and body such LSD or mushrooms. Opiates are prescription painkillers. Angelas, heroin, marijuana, and speed.
So, how can you tell when one is using drugs? You can you can tell that one is using drugs if you observe a lot of changes in that person's behavior, appearance, and mood. In its behavior, you can observe or you can see that those people are irritated, discourteous, defiant, and aggressive, untrustworthy, and lack self-confidence. So the people who are using or abusing drugs, you can see that they're irritable to any kinds of distractions and very aggressive. They react immediately to something that is not actually not reactable at all. Then they're untrustworthy, you cannot trust them at all. Then lack self-confidence, so they're not confident enough with the things that they're facing. And their appearance, you can see that they're unhealthy and unconcerned with good grooming. So you can see that the people who are abusing drugs doesn't care of their physical appearance at all. They don't care if they have already long hairs, beard, or anything. They don't care if they're clean or dirty, as long as they're happy with what they have right now. They don't care at all. They don't care if they look so untidy or anything. In their mood, you can see, and the people are abusing drugs. They have a low frustration tolerance. They get easily frustrated in small things that can eventually solve at your own, but they easily get frustrated in it. Lacks interest in his studies and work, so they don't care if they're doing good in school or at work. They don't care if they maintain good stands or good grades or good work. They don't care at all because they don't have any interests in it. So blames everybody for his problems. Just like the number 4 said, it says low frustration tolerance, and it blames everybody for his problems. So if they easily get frustrated, they easily blames everyone that surrounds them with everything everything that happened to itself, or everything that every problem that they have, they blame it to other people. Prefers his barkada where he feels accepted. They set it to their mind that only their barkada accepts them, because their barkada let them do what they want, let them take what they want, unlike their parents. So they think that their barkadas are good. They think that their barkadas accepts them for who they are, because that's what their mind build inside their brain. So that is why crimes and rape are rampant in a country or in a place where there are a lot of people abusing drugs. Basically, the mental health is the most affected aspect when abusing drugs, and we all know that our brain is the one who's carrying our whole body, our whole being. So if your brain is affected, eventually everything in you is already affected.
I am here in front of you to discuss what are the ill effects of drug abuse. First, malnutrition. They miss their regular meals because they lost their appetite. So, why do drugs users suffer from malnutrition? Effects of drug use in dietary intake, macro and micronutrients in the short term. Opiates cause anorexia, decrease food consumption, and reduce gastrointestinal motility, all leading to malnutrition and increased risk of infections in the long term. Second is panic reaction. The loss of thought processes can cause panic reactions or feelings of invulnerability. Both of these states can lead to injury and death. If you've taken a drug, you may act differently, feel differently, and think differently if you've taken drugs, and you may struggle to control your actions and thoughts. Third, physical damage. Liver and kidney damage may result when large quantities are taken. Many who abuse drugs also neglect personal hygiene, which leads to multiple health problems. Kidney failure, hepatitis, drastic weight loss, and vitamin deficiencies are some of the adverse physical complications. Drug use can also result in long-term health outcomes that include harms to organs and systems in your body such as your throat, stomach, lungs, liver, pancreas, heart, brain, and nervous system. Also, acne or skin lesions if the drug you are taking causes you to pick or scratch at your skin, jaw, and teeth issues due to clenching and grinding your teeth, or bad breath, teeth cavities, and gum disease. Thank you.
What can a person do to prevent drug abuse? First, maintain good physical and mental health. As much as possible, avoid stressing yourself. Do regular exercise, just simple ones. Just like when you wake up in the morning, you can stretch your arms and legs and start your day with a smile because it can affect your whole mood the rest of the day. And also make friends and make yourself happy. Second, use drugs properly. If you ever got sick, take your medicine at the right time of the day and make sure you're taking it properly. And never ever take medication prescribed for someone else. Third, understand your own self. Avoid feeling insecure with others because it can affect your perspectives towards yourself. Be confident, appreciate, and love yourself because only you could better understand of who you are. And by knowing your value, it can help you identify solutions to your problems without using illegal drugs. Fourth, developing your potentials. Together with your friends or family or boyfriend or someone special, you can learn new things and make it a hobby along the lines of cooking, swimming, hiking, sports, and more. Fifth, communication. Communication is very important. When you happen to know someone who is struggling, he or she needs help. Talk to that person without judging his or her situation. But if you don't have something nice to say, you can zip your mouth and just keep it to yourself and just listen. Giving advice is not necessary because sometimes it can add more problem to that person. The same thing to everyone. If you ever feel like quitting or giving up, please tell someone else or talk to someone whom you're comfortable with. You can cry and ask them for help. Never be ashamed of your circumstances because we all have that. Number 6, learn to cope with your problems and other stresses without the use of drugs. If we can solve our problems, if you can find solution to your problem, minor problems, then do it. Stop thinking negative thoughts and as much as you can, help yourself to not engage in illegal drugs and other bad things because it can only make your problem worse. And 7, seek professional help if you feel you cannot cope with your problems anymore. If you ever feel like you can't win with your problems you're dealing with right now, then it's time for you to seek professional help. Just like in our school, we can go to the OSA or the Office of the Student Affairs if you really need help. Don't be scared to approach nurses or doctors because they can help you. And the last one, develop strong moral and spiritual foundations. Of course, this is the most important one. As a believer of God, as a Catholic, I do believe in answered prayers. I do believe in God. So, whenever you are stressed, depressed, or having an anxiety attack, please take time to talk to God because it can really help boost your spiritual aspects. Just like it can relieve your burdens, and yes, please do believe in God and learn to share your problems to Him. That's all.
Okay, the role of the youth on drug detention and prevention. So the first one is be firm to say no to drugs because we all know what is the effects of the drugs in our body and also importantly in our brain because it attacks our brain, but it depends on the drugs. And number 2, connect with your friends but avoid negative peer pressures. In peer pressure, in our PPT, there are 2 pictures, and the first one is the positive one, and the second one is the example of a negative peer pressure. They're pressuring you to do drugs and do alcohol. And also be firm to say no with that because you don't want to waste your life. And next, number 3, make connections with your parents or other adults because they have the best advice because they know you and they know what to do in your current situation or what your problems are. And then number 4, I think this is the last one. Enjoy your life and do what you love. Yes, life is short and do not waste it on drugs or on alcohol because that is extremely dangerous to our health and also it can also kill us. And I think that's all.